Types of fixed prostheses. Fixed prostheses are designed to replace the missing tooth structure in a variety of ways, including full crowns, partial crowns, inlays, one-lays, bridges, and veneers. They can be completed using the indirect technique. The indirect technique means the restoration is not placed directly in the tooth preparation as it is with composite and amalgam fillings. The indirect restoration involves preparing the tooth, taking impressions, and placing a provisional restoration. The impressions are sent to a commercial laboratory, which then fabricates the permanent prostheses. The patient comes back for a second appointment to have the restoration cemented or bonded in place. This restoration is also known as a cast restoration. Indirect restorations can also be created with the use of the CAD/CAM, computer-aided design, computer-aided manufacturing technologies. See Chapter 34, Computerized Impressions and Restorative Systems. With a CAD/CAM system, the tooth is prepared and the restoration is fabricated right in the office. After the tooth is prepped, the computer program is used to design a crown, inlay, and so on. This information is sent to the milling machine, which is right in the office, for fabrication. Once completed, the finished restoration is ready to be cemented or bonded in place. The patient only needs one appointment and never has to wear a provisional restoration. Crowns. Crowns cover teeth that have extensive decay or breakdown. The prepared tooth is covered with an anatomically shaped and fitted crown. Crowns are constructed of various materials, including full gold crowns, porcelain fused to metal crowns, or full porcelain crowns. The tooth may require a full crown, which is often referred to as a full cast crown, figures 33-1A and B. A full crown covers the entire coronal surface of the tooth. Sometimes, the tooth is broken down so badly that means to retain the full crown on the tooth are required. Retention is discussed later in this chapter. A partial crown is a cast restoration that covers 3 or more, but not all, surfaces of a tooth. A 3/4 crown is normally prepared so that the mesial, distal, and lingual surfaces are reduced but the facial surface is left intact, figure 33-2. The incisal or occlusal surface of the tooth is also reduced. Inlays and one-lays. Inlays and one-lays are restorations that replace the missing tooth structure within the tooth. An inlay covers the area between the cusps in the middle of the tooth and the proximal surfaces that are involved, figure 33-3A. Inlays are MOD, mesio-occlusodistal, MO, mesio-occlusal, DO, disto-occlusal, or O-occlusal. An one-lay is like an inlay except it includes the cusp ridges of the tooth, figure 33-3B. Inlays and one-lays are also cast restorations that are made of a variety of materials. The extent of the lost tooth structure and the preparation determine which type of cast restoration is best suited to restore function and preserve the strength of the tooth. Bridges. A bridge is a restoration that spans the space of a missing tooth or teeth. The bridge is divided into units, and each unit of a bridge represents a tooth. A bridge may replace one or more adjacent teeth in the same arch. The missing tooth is replaced by a pontic, which can be designed in a variety of forms. Two common pontics are the hygienic, free cleansing sanitary, and cosmetic, ovate. The hygienic pontics allow for space between the tissue and pontic, usually seen in the posterior area. The cosmetic pontics are tooth-colored and fill in the entire space to the gingival tissue. The teeth adjacent to the pontic are called abutments. Crowns, inlays, or one-lays may be placed on the abutment teeth to support and stabilize the pontic, figures 33-4A and B. Bridges are made of a variety of materials to meet the patient's aesthetic and functional needs. After the bridges have been fabricated, they are permanently cemented in the patient's mouth. Bridges can also be retained by one or two teeth on the same side. This type of bridge is known as a cantilever bridge. The cantilever bridge is used in areas of the mouth that are under less stress, such as the front teeth. This procedure involves anchoring the false tooth to one side over one or more natural and adjacent teeth. A Maryland bridge, or resin-retained fixed bridge, is used to replace one tooth. Abutment teeth have very little tooth structure removed during preparation. The bridge consists of a pontic with extensions, retainers, of varying shapes. The extensions are designed to attach to the abutment teeth, on or toward the lingual surface. The retainers of the Maryland bridge are roughened by electrolytic etching to increase their bonding to the natural tooth structure, figure 33-5. Preparation of the teeth for the Maryland bridge is usually minimal. The impressions are taken and temporaries may be placed. The laboratory procedures are the same for all cases except the electrolytic etching of the inside of the bridge retainers. Cementation steps are as follows. 1. A dental dam is placed to protect the tissues from the acid etching. 2. The abutment teeth are cleaned with pumice and water, and then rinsed and dried thoroughly. 3. The prepared surfaces of the teeth are acid etched for 30 to 60 seconds, rinsed thoroughly, and dried. 4. A dual-cured composite cementing material is applied to the etched surfaces of the bridge retainers and the etched tooth surface. 5. The bridge is positioned on the abutment teeth. 6. Once the material has set, excess cement material is removed. Veneers. A veneer is a thin layer of tooth-colored material that covers much of the facial surface. Veneers are used to cover teeth stained intrinsically. Teeth affected by abrasion, erosion, and enamel hypoplasia. Or to reshape the anatomy of the teeth. Veneers improve appearance with very little removal of the tooth structure. Examples include the following. Full facial coverage on anterior maxillary teeth, covered with veneers for a natural appearance, figures 33-6A and B. Tetracycline stains on the maxillary anterior teeth, veneers cover the stain for improved appearance, figures 33-7A and B. Diastema, an abnormal space between two adjacent teeth in the same arch, on maxillary central incisors, veneers close the space, figures 33-8A and B. Veneer procedures are changing constantly as technology progresses. There are many types of veneers, materials used, and techniques. Direct resin veneers, indirect resin veneers, and porcelain veneers are the three types that are discussed in the following sections. Direct resin veneers. A direct resin veneer is made in the dental office directly on the patient's tooth. This procedure requires one appointment. In preparation for the veneer procedure, little, if any, tooth structure is removed. The tooth is etched, adhesive is applied, and opacas and body shade are placed. The incisal shade follows. The shade can be varied between the incisal edge and body of the veneer. The veneers are contoured and finished. Generally, these materials are light cured and require routine polishing and periodic maintenance. Indirect resin veneers. An indirect resin veneer requires 2 appointments. At the first appointment, the tooth is prepared and an impression is taken. The impression is sent to the laboratory for fabrication of the veneer. During the second appointment, the veneer is bonded in place. These veneers do not bond well to resin cement. They lack strength and wear at a faster rate than porcelain veneers. Porcelain veneers. A porcelain veneer is similar to an indirect resin veneer in that it requires 2 appointments and is fabricated in the dental laboratory. Porcelain veneers are natural in appearance and are durable. The technique for the porcelain veneer is sensitive to shade selection and gingival margin adaptation if the veneer is to look natural and adapt well. Procedure 33-1 outlines the steps involved in placing porcelain veneers.